Hi, this is Dr. Ross Carter, and welcome to the Medical Influencers Show. Today, my special guest is Dr. Eric Kephart. Welcome to the show today.
Thank you. Thanks for having me.
It's a pleasure to have you. So, today we're primarily going to be talking about bioidentical hormones, and you're a specialist in that. Is that correct?
That's correct. Taken on advanced certification through organization to educate myself and learn a little bit more about what the role of hormones and how we can use them to safely and effectively help patients as they age.
And what type of patients would this be great for? Who are you looking for primarily?
Yeah, for the most part, it's men and women, and typically over the age of 45, 50 and older are going to see most of the benefit from supplementation or replacement of hormones secondary to the natural decline and loss that we see within that age group.
Beautiful. And so is it men more than women or women more than men, or is it kind of a mix of both?
It's typically a mix of both. I think that women certainly symptomatically know that there's changes that are happening, and they are more in tune with that. The men kind of just slowly realize that they can't exercise or do the work that they wanted to do, or recover as well as they used to. And there are different hormones, for each of the sexes. So, but women certainly understand the symptoms that come with a decline in their hormone levels.
So when I would say if I talk to a guy, just a non-medical guy, and I say something about hormones, they typically don't think of themselves as much as having problems in their hormone levels. They could say maybe I have a low testosterone, or they go hormones. That's really more my wife. She's all hormonal. You know what I mean? So it's when you say hormones, especially bioidentical, a lot of times it can be just thought of as only a feminine problem, but this is really for both, right?
Yep. I think both. We like to include, testosterone, certainly for men and women, but the men certainly. We include vitamin D in the hormone replacement. It's vital and crucial to a lot of our processes that go on, especially our immune system. And we also do a growth hormone releasing hormone, which men benefit greatly from, as well as the women. So there are a number of things that both men and women will use and benefit from a BHRT standpoint.
Beautiful. So let's say someone is watching this and they go, well, how do I know? Let's start with one sex at a time, because it's probably going to be different here. So let's start with men. As a man, how would I know if I have a problem either with my hormones and that I need to do something about that, as well as why would this be a good solution or potentially be a good solution?
I think that aside from laboratory tests, which is what I would do medically speaking, but a man would see, maybe some difficulties with his sleep, maybe some of the difficulties he would have with activities, or even his exercise routine, or even just everyday activities or work routines, that more fatigue, inability to do the work that he used to do, or the inability to recover. And I think the other thing that men will notice a lot would be, weight gain or increase in fat where they don't want it, despite, not increasing their eating habits and still working hard. Because of the loss in hormones, we really lose that ability to, our body composition will change. So those type of changes happen slowly over time. Those would be signs that, your hormone levels are declining. And then to replace them, you would see we could potentially take you back to a level where you're at before, and you'll see those changes reverse essentially.
And would it be similar in this case with a guy? Would it be just simply taking a shot of testosterone?
Yep. You could take testosterone, and it comes in injection form, pill form, cream form. So there are multiple ways of doing it. But yeah, it could be as simple as that to boost your levels and still stay within a relatively normal range. It's just the levels go so low that we could, just with supplementation, you can improve the testosterone level, and then you will see that effect then, in your daily life.
And what is the effect that they're going to see? If improvement of sleep, as well as, go ahead.
Sleep, they'll improve in sleep, recovery then, so they'll be able to recover from their day. They'll see an increase in we call lean muscle mass, but their strength will improve. And testosterone is fantastic. I say it gobbles up and eats away visceral fat. And that combination of those two things, if we increase lean muscle mass and then decrease visceral fat, the combination of those things happening together changes the way you can go about your day. It really makes a difference in how you can function.
Perfect. And so that's if, so for a man, fairly straightforward. It seems like as you start to age and you're not getting the workout, like, you're not getting the benefit from the workouts, and you're basically starting to gain a lot more fat, there could be a problem with your testosterone levels that's causing that, right?
That's right. You feel like you're just spinning your wheels. I've done this my whole life. It's always worked for me. And now I can't seem to get where I used to be. And I'm getting bigger, I'm gaining weight here and I shouldn't be.
And then you start to feel, shoot, I'm getting older now, right?
Yep. And then you wake up in the morning, you're like, I can't get out of bed like I used to. And you can't reach over and tie your shoes the same way. So everything just kind of clamps in, and you feel like I'm becoming this old person.
Well, what if I went to my doctor and they tested my testosterone, just my traditional doctor, and he said, your testosterone levels are normal? What?
And that's true. From a standpoint of a diagnostic standpoint, we'll use a lab value of say 300. It depends on what lab you use. But so most men, honestly, 40 and over, are going to be above probably 300. They may be 350 or 400. And that's where the difference from replacing it is. That range on your lab value, it may go from 300 to 1,000. So technically speaking, you could be normal on the normal range. But if you were 350, I could potentially double or triple your testosterone level through supplementation. You'd still be in the normal range. And imagine what happens if we double or triple your testosterone level at any age. But in the idea, we're still not super physiologic. We're not trying to make, you won't become, a muscle-bound bodybuilder through supplementation.
Yeah, because that's where a lot of people think. Well, they go I'm either going to just waste away, or I'm going to suddenly, become a steroid big muscle guy. But that's not where we're looking at. We're looking at between all those, right?
Yep, we're still maintaining a normal laboratory range whenever we give the medication. It's just that the value goes to such a low level that to even double it, you stay in normal range, and you've really enabled your body, given it the tools it needs to recover and to be able to perform better on a daily basis. So
because your testosterone levels when you're young are different than they typically be normally as you get in your 50s, right?
That's correct. Yeah. We're not going to touch the levels you were at when you were invincible at 16, 17, and 18 years old. But, just to even get to a level that is, twice of what you are at 50 makes a significant difference in how you function.
What's the normal testosterone levels in your 20s?
In your 20s, you could still be, it depends, a little bit, but you could still be in the 1500s, wow. We've seen up to 2000, in the younger, these healthy young boys that are just like, you see them as they just change and blossom real quick.
Yeah.
Their levels are high. Now, it doesn't stay there for long. It is a short period of time. And then unfortunately, drastically declines then once you get to, even in your 30s, the decade of your 30s, it starts going down dramatically.
It sounds depressing. So what is the ideal level that you want to be at? Obviously 1,500, 2,000 is when you're a teen. And if you're 50 and you're at 300, there's a huge range there.
Yeah, I would like to see, a 50-year-old, if we can get them in the 600, 700, 800 range, they're normal. They're not going to have the side effects from that. And their life is going to change so much that we don't have to, we don't push the level into those high ranges. We're just happy with a 600-700 level,
Mm-hmm.
800 level. That patient does wonderful.
Now, how long do they stay on this? Is this lifetime or how long is that?
They can. There's no detriment to being on it. It's not going to do anything. We do check, some other lab values, and we watch, for unwanted side effects and things like that. But as long as you stay in a normal range, like we're saying, you can stay on testosterone until you want to stop it. And if you want to, you can stop, and your testosterone level just drops back down to very low.
Sounds great. So now that was for guys. Now, how about for the women? So how do they know, and what does bioidentical mean? Bioidentical hormone. What does that mean exactly?
That's really important because, and especially with the women, I think that they're more sensitive to, if we start talking about estrogen and progesterone, we've known that those are important hormones as they reach menopause. They go away, and we want to replace them. We've tried to in medicine. It's just that we haven't done it well in the past and caused problems. Bioidentical is the key in that when we give bioidentical estrogen, we give estradiol specifically, which it is the chemical structure that you naturally had. I'm sorry. Sorry about that. So sorry. So we give estradiol as, I apologize. So we give estradiol, that is the exact chemical structure of estrogen that is in the active form for a woman.
Okay.
If I get that, I don't get the unwanted side effects or problems that I have if I were to give, say, a different form of estrogen, which needed to be converted to the active form. So when we do bioidentical, it is actually what your body needs. And so we get that through a compounding pharmacy. That way, the patient is safe, and that also keeps me safe as far as what I'm prescribing. I want to make sure that my patients are healthy and can do well on the medications.
Now, does pretty much every woman as she gets older, would they benefit from this?
Yeah, all women are going to go through menopause, and so they're going to be, their estrogen and their progesterone levels will drop. And we certainly think of 50 as an age, although we're seeing more and more data that it's in the late 40s that women are starting to see the changes, and that's a good time to I'll say reintroduce or to maintain that level, and now it would be through supplementation as opposed to what they naturally are producing, so that we really, ideally from a health benefit standpoint, we'd like to see estrogen on board at some level for their whole life so that they have that health benefit. We think of bone loss, in the heart, in the heart disease, and the blood vessel structure, that estrogen is very important for that. And to be without it for a period of time and then try to reintroduce it even becomes more difficult to regain the health that we had before.
So it's better to kind of, as you get older, to start just, do you just need to get lab tests to determine if it's at a level, or do you just start at a certain age?
That's correct. No, we'll check a laboratory value so that with estrogen especially, if there's any estrogen or you're still producing some, no matter what your age, I can't give estrogen then. That would be a problem. So we want to make sure that you're no longer producing any estrogen at all. And then we can reintroduce at very small doses if we need to, as we ramp it up to a desired level, estradiol in the form of capsules or creams with that too, to maintain then an estradiol level that is health benefit to you.
And so how does a woman know, I guess, the changes? What are the symptoms that they're typically experiencing?
So I think a lot of women will complain of the hot flashes and the mood disturbances that they see, the sleep irregularities, the waking up at night, the urinary complaints. It really affects your general system, so they have dryness, etc., difficulties for painful intercourse. All those things are likely directly related to hormonal changes.
Got it. And this happens in their late 40s or in their 40s, their late 40s area?
That's right.
And to supplement their hormones, how do they do that? Is it a daily thing or?
Yeah, typically that's what I do. I would like to give daily capsules, from a standpoint, estrogen, progesterone, those two, especially testosterone, just as it is for men, can be given an injection, or it can be a daily cream too. It's just a matter of maintaining a level that is comfortable for them and that gets the laboratory values where we want them to be. And then it's rather easy to maintain that as you go on over time.
Got it. So basically, once you have it at a certain level, you just want to keep it at that level pretty much the rest of your life, I assume, right?
Yeah, exactly. Yeah, you will continue to have that benefit as you move forward. If you stop, your levels go back down, and then you would have the declining or the aging process really take full effect. And so what we're doing is we're not really creating a young person. We're just allowing them to age a little bit more gracefully, if you will, or have that better quality of life as they age.
Okay. Yeah, because it would have sold a lot better if you just said, "Hey, I'm going to make you younger now."
I know. That's a difficult thing to say, but in some respects, they feel younger and they can do things that they did when they were younger, but it doesn't cure some disease process or something like that. So yeah, you want to manage those type of expectations.
Now, is there a difference between using your bioidentical hormone and say using like a birth control, for example?
Yeah. The dosage is going to be different, and we really want to use the capsule form from estrogen is so much better that it's all about the dosage is what we need to do. And so we'll check levels. We're not going to reintroduce someone to having their menses again or things like that. So we test that through laboratory studies and make sure that those levels stay where they need to be. But the dosage forms are totally different than what you would get in a contraceptive pill or even an injection from that standpoint. We can manage, and sometimes you'll see it's difficulty managed or getting somebody on the hormones and they say, I started bleeding. Okay, well, we need to adjust that. That can be some of the workings out of it, but that's not the goal. So.
Mm-hmm. Got it. So, well, it sounds like it really for men and women as they get, in their 50s, it sounds like we pretty much all need to get some type of hormone replacement to make sure that if we want to stay feeling as young as we were, right?
That's correct. Exactly. If you want to maintain that youthful lifestyle and that, the ability to go and play with your grandkids and not be worried about the next 3 days after because you can't move, or difficulties in recovering, all of those things, and your sleep at night for recovery, all these things can be managed effectively and safely, through BHRT.
What's the most common concerns that people have when they start a program like this that you can mitigate now?
I think the biggest concern is estrogen and some of the stigma that it has from what has been done, from study standpoint and through media and some of the press has gotten in the past, as far as being a medication that can cause harm.
Yeah.
And I think that's smart and that's wise to understand that and to look at that. But we also can look at those studies and see that the estrogen that was used that caused harm is not what we're using in BHRT, and that even in those studies, some of the arms used actual estradiol E2 and saw benefit without risk. So we can, just dispel those through looking at the studies a little bit further and really honing in on what is beneficial and what can cause harm. So those are good concerns.
Yeah, absolutely. Fantastic. So if somebody, what area, where do you practice?
We're in Doylestown, Pennsylvania, just a little north of Philadelphia. And so we're here, and this is a great program from a telemedicine standpoint too, because we can have a conference and order laboratory studies. They can get them done at their own lab. I get the results, and we can discuss, treatment options or how we can effectively help them reach their goals.
Beautiful. How would someone get in touch with you?
The best is, our phone is 267-406-4083. And we're on the internet at KephartIntegrativeMedicine.com. And you can also drop email there at info@KephartIntegrativeMedicine.com.
And Kephart is spelled Kephart.
Correct.
Perfect.
Yep.
Beautiful. Well, that's good. That's good. I think that's an easy way to get in touch with you. Is there any other any other information that I failed to present that you'd like to discuss?
No, I think that's good. Every patient and every treatment program and treatment plan is individual. So not everybody is going to go and take a big bag full of medicine or pills, and some may take a cream or a pill or an injection.
Yeah.
And so individualized treatment is important, and we want to help patients reach their goals. And so we are certainly willing to help them and give them the knowledge that they need so that they can make good choices for their health.
Beautiful. Very nicely said, Dr. Kephart. Thank you so much for your time today and for the really helpful information.